To get us to this point today, where we're able to consider real opportunities and use strategic directions to improve Aboriginal health outcomes, an extensive consultation and engagement process has been undertaken. But this is just the beginning.
And as many of you would know and heard me speak about before, for the Aboriginal community control sector, and I'd certainly like to acknowledge Sandra and Christine here today and all the members in that sector, that's been quite an interesting journey in many respects, but a success story. How we help move the whole service delivery sector to the next level, I think, is really about what the 10-year planning process is about. But I look forward to continuing to work together to close the gap in health outcomes and life expectancy between Aboriginal and non-Aboriginal people. It's your work that will help us to close the gap in health outcomes and life expectancy between Aboriginal and non-Aboriginal people. It is important work. We want to get on with it, and we're committed to this process. And again, I'd like to thank Carmen and Kerry and your team for helping us to get to this point today.
It was in 1995 that the AHMRC signed the first partnership agreement with the New South Wales Government through the Minister. We are proud to be partners in this process. We thank the Government for recognising us in that process and for honouring the partnership agreement as they've come into power here. And we look forward to the long-term planning that needs to take place to fix the problems in Aboriginal health, which will require sustained effort and clarity about what everybody does and what's needed to fix the problems that exist for Aboriginal people.
How can we together transform the way we work and collaborate to significantly improve health outcomes of Aboriginal people across New South Wales over the next 10 years? And it was quite a purposeful question, because we really wanted people to think about what it is that we really need to do in New South Wales in terms of addressing the challenges and the complexities facing us in New South Wales to close the gap in Aboriginal health. We summarised a lot of the first phase of consultation, and there's a paper called Consultation Paper 2, which gathers and synthesises all the information and presents some essential building blocks for the future. And what we've been able to do is to translate not only those building blocks into the strategic directions that are reflected in the discussion paper, but also have been able to present a framework which is represented in your discussion paper that you have there concerning a future vision around Aboriginal health. We've also built in the definition of Aboriginal health, which adopts the 1989 National Aboriginal Health Strategy definition, because it's a widely used definition. We've presented a goal in the discussion paper, and then we've presented these strategic directions with a set of proposed or strategic actions that arose out of the actual consultation process.
But the gap for me is that there is a big gap between the services not working together. It's not the delivery of the services, it's the design of the services at a senior level, where people are working together so that what they agree on flows on the ground.
Our hope is to achieve better outcomes for Aboriginal people in health, and to close the gap through proper planning, which directs everybody's efforts, be it stakeholders, service deliverers, policy makers and funding bodies, towards an agreed strategic approach as to how we go about improving Aboriginal health.
Well, the plan itself, it's great that New South Wales Government is having consultations with the community, and I think we need to have these consultations from the community perspective so we can be part of the actual plan. I suppose what I'm looking personally out of the plan is that the government will resource a plan in terms of how we move forward and implement any recommendations or strategies.
At an LHD level, I think we are scurrying around trying to work towards long-term goals, but sometimes they're a bit unclear about what those long-term goals should be, and we get caught up in the day-to-day business of service delivery, and I think this plan can help us achieve an overall direction and making sure that we are on the same path, and also sort of clear up the fog, if you like, around what are we doing, how are we doing it, how are we measuring it, and how are we reporting against it. And if this plan can consolidate all of those different priorities and approaches and give us one streamlined direction that we can apply to our different services, then that will make it easier for everybody.
My vision for the Aboriginal Health Plan, and as I said earlier, was to see transformation happening in the way that health services are provided to Aboriginal people, and in particular requiring us to do our business differently, to work in partnership with community, to draw on the strength and expertise from community and providers, and to provide a service that is of a high quality.
I think the other important reason for getting everybody engaged in the conversation around where the plan should go is so that we do draw on the wealth of experience and knowledge. And finally, the difference between communities is often overlooked at a policy level. I think getting more people involved in the conversation allows us to start identifying some of the differences that we need to address if the broader plan is to be applicable across the whole state.
Well, I'm quite passionate about improving Aboriginal health outcomes. I've worked in Aboriginal health now for over 15 years, and of course I want to see the next generation that comes through is a healthy generation that takes our our kids, and our future, I suppose, is going to be a lot better than the current generation. So I think that if we can build something today for the generation that's coming behind us, I think that we'll certainly reduce that gap in health outcomes for Aboriginal people between Aboriginal and the non-Aboriginal population.
Well, I think particularly ensuring, if we want Aboriginal people to be walking through our health services, then we need to make sure we understand what the issues are for them. I was just in a forum just then where we have so many state and commonwealths indicators that we sometimes forget the voice of. We need to understand what the people actually really want out of their health services. So I think hearing that voice first and ensuring that that is leading our thoughts in how we're driving our Aboriginal health plan is really critical.
I basically just want to see it happen, and hopefully at the end of the day, when the plan is completed, we can have some real strong partnerships with New South Wales Government and New South Wales Department of Health to actually get on and do a better job than we've done in the past, and work together. I mean, really a genuine commitment to working together. That's one of the things I really see. The opportunities here now in 2012, and it's supposed to be a lucky country we're living in, and we need our people to live longer and better lives and have a real opportunity in life, in terms of employment, opportunities for our children, that sort of stuff.